Hello, hi. I am Vinod, representing Study Abroad Educational Consultant, Chennai. I welcome you all to the webinar on behalf of Study Abroad Educational Consultants and Russian Cultural Center. Study Abroad had been an exclusive preferred partner of Russian Culture Center, which is the culture department of Russian Consulate in South India. Study Abroad had been sending students for the past 3 decades to Russian universities for various specialization and to MBBS courses in large numbers. The Ministry of Health of Russian Federation appointed Study Abroad as its authorized representative in 1994 to select Indian students for admission into various medical institutions in Russian Federation. The Ministry of Health and the medical industry of Russian Federation is the supreme authority functioning under the Russian government, and the medical institution of Russian Federation comes under its jurisdiction. Study Abroad is also the exclusive representative of some of the world leading universities like Kazan State Medical University, Far Eastern Federal, Medical Institute of MEFI, Volgograd State Medical University, Kursk State Medical University, Russian State Medical University, Moscow Aviation Institute, to name few. So far, around 400 Indian students have successfully gone to Russian universities to complete their academic pursuits in the chosen profession in Russian Federation. Every year, around 300 students are admitted through Study Abroad. Study Abroad has been two-way gateway between the parents and the university in Russia in helping them in admission process. Today, we have got Mr. Timur Akametov, Vice Dean for Foreign Students, who is about to talk about MBBS in Russia and in particular Kazan State Medical University. Before I hand over the screen to Mr. Timur, I would like to give a few points about Russian education and Kazan State Medical University. As a consultant, we can guarantee transparent admission process and also a very high quality of education in Russian Medical University, because these universities are maintained by government, Russian government. So this is the reason why the tuition fees are very highly subsidized. Here also, I like to stress that the teacher-student ratio in Russian university is 1:7, which is very unique and not available in any university or country which are offering medical education for our Indian students. Regarding Kazan State Medical University, this university was established in 1814, and this is the third oldest medical university in Russia. Kazan State Medical University is a multifunctional and multi-level state institution for higher learning in medicine. Kazan State Medical University functions on the basis of self-governance and belongs to a system of higher education and scientific research of Ministry of Health of Russia. Now, I request the students who have joined the webinar, please I request your parents also to join this webinar, so they will also understand about the MBBS in Russia. And I also request, till Mr. Timur finishes his presentation, I would like all the participants to mute your mic so that there will be no disturbance no disturbance during his presentation. If anybody does not understand, you may also raise your hands and you can raise your questions once the presentation ends. For anybody who is new to the Zoom, can also raise your question in the chat option in the bottom corner of the screen. Now I request Mr. Timur, now you can address the students, sir.
So we can start.
Yeah, sir, you can start, sir.
Namaste. I am just regret I cannot see you in person for 12 years I've been visiting Chennai, and that's the first year we're not having that Viva conferences in Chennai, educational centers. And I'd like to say a few words about our institution, and you might be interested in knowing how our students study and about our city. Students are not only choosing university, they're also choosing a place they are going to live for 6 years. So we teach for 5.8 years, 6 years. You'll need to stay in Russia. You may start our presentation if possible. So there is a presentation about our institution, and after that explanatory words, you are welcome to ask questions. I will gladly explain some questions about our study process. So as he starts, as for me, I'm a faculty of this university. I'm a pathologist, MD pathologist. I teach a discipline which is called anatomic pathology or pathanatomy, which is taught on the 3rd year. So our course is divided into 6 years, and we have 2 years of completely theoretical disciplines such as anatomy, histology, biochemistry, physiology. Then preclinical disciplines, and our discipline, pathanatomy, is preclinical. And we teach microscopic diagnosis of diseases and structural changes in diseases. Just I don't see the presentation, unfortunately. Presentation is not working. There might be some technical issues. PowerPoint presentation, it's not showing.
Yeah.
Okay, just I'll go on. Our course is divided into 6 years. 2 years as fundamental theoretical, then preclinical disciplines, and first introductory clinical disciplines such as internal medicine, and students are getting acquainted with hospitals in the 4th course. 5th and 6th years are completely clinical. So gradually we prepare students to work in hospital. Also, many students ask me that do they need to learn Russian? Russian is one of the subjects which is taught to students for the first 3 years. It's compulsory to learn Russian. It's one of subjects they'll get an exam and mark for knowledge of Russian, but it's not necessary for admission. During 3 years, they gain good knowledge of Russian, and from the 4th year, they'll have duties at the hospital. They'll have some observation duties at the hospital. They'll have contact with patients, with doctors who mostly speak Russian, and they need to know some Russian. Russian is compulsory to be studied, but it's not compulsory for admission. And students have no problems with Russian. Russian is not difficult for Indian people because of some similarities of pronunciation or just building sentences. So Russian is not a problem. The most difficult subjects can be anatomy, biochemistry, pharmacology. Pathanatomy is also rather difficult. You need to learn many diseases. And pathanatomy is like a language of diseases. We teach you terms, we teach students how diseases develop, how they're diagnosed. And from the 4th year, students learn how to treat them. So there is logical process. So first we teach physiology, how body functions, anatomy, how body looks, and biochemistry, some other subjects such as medical physics, about medical instruments, medical statistics. Those are fundamental, important disciplines. Then preclinical subjects, and finally study in hospitals. And we have more than 50 hospitals connected to university. Students have experience in our special college rooms in hospitals, and they have real practice. That's also a unique opportunity, because in many colleges worldwide, students are not allowed to be in a hospital, to visit patients. Undergraduates are not allowed. But in Russia, still, students have such opportunity, unique opportunity to have contact with patients and to see how surgeon works, how nurse works. So they'll see real hospital's life inside, from inside. That's a good opportunity. As for Kazan, unfortunately, I don't see our presentation. We have long experience of teaching Indian students. For almost 20 years, we have foreign students, and many of them are from South India. So we teach in English medium for 20 years, and currently we have almost 1,000 Indian students in Kazan Medical University. Just more than 900 Indian students currently in Kazan, and they provide safety and all necessary facilities for studies. They get hostels, they get security systems, they get cafeterias, canteens, libraries. All of our buildings are heated. There are no problems with temperature in winter. It's quite cold outside. In winter, it's usually -10, -15, but all of our rooms are heated to +25. And it's always warm in all buildings, in all corridors. Everywhere it will be warm inside. Yes, for walking from building to building, you'll need to wear a cap, a good coat, good boots. And also, so extra expenses, you'll need to buy here some clothes, but those are affordable, and students have no problems with that, with buying clothes. Food is also available, and many students cook themselves because it's cheaper to buy food and cook yourself rather than to go to cafeteria. Students want to save that. Our tuition fee is currently in rubles, but ruble is almost equal to rupee. Ruble is almost equal to rupee currency exchange. And in rubles and in rupees, our tuition fee is 3.8 lakh per year. 3.8 lakh rubles or rupees per year. In United States dollars, it would be 5,500 per year. And 200 per year for hostel. 100 per year for medical insurance. So that's for our expenses. And also students will need to have some money for their daily expenses, for cafeterias, for maybe some clothes and so on. Usually they spend about 10,000 per month. 10,000 per month for just monthly stay for life. That may vary from 8 to 15. That depends on where they eat. If they eat in restaurants, they'll cost more, but around 10,000 enough for stay. It's less than in Moscow. A few more words. Just unfortunately, I don't see our presentation, but for many years our university gets top places in Russian rankings of medical colleges, and we got second and third positions several times. So we are among top 5 Russian medical colleges, and we are just after Moscow medical colleges, but 2 times less than in our tuition fees, 2 times less than in Moscow. So we're among top 5 medical colleges, but our tuition fee is less, and Kazan is easier to live in. It's compact, almost 2 million people population, while Moscow is 12 million. Moscow and Kazan can be compared to Mumbai and Pune. So where you prefer to stay and live, in Mumbai college or Pune college? So many, less crowded place, but with all necessary places, and we can be called like compact Moscow. So Moscow is luxury place with lots of entertainment, but it's not necessary for students. And it's more expensive. Moscow is more expensive. Moscow is like Mumbai, while Kazan can be compared to Pune in Indian geography. Pune is also city of universities. There are lots of colleges in Pune, and Kazan is also city of colleges. It's not only medical college. We have technical, humanitarian colleges in Kazan. And foreign students also come to other colleges, like from Africa. They study in that humanitarian colleges and engineering colleges. But majority of Indian people, they choose medicine, and one of the oldest medical colleges, Kazan Medical University, which is 206 years old. 206 years old university, established in 1814. Recently we had our birthday. On 14th of May, we had a birthday of our college. 206 birthday of medical college, and also we gain and accumulate knowledge and experience of teaching Indian students. One of advantage that many of our graduates already passed their screening tests in their countries. Not only in India, some of them travel to Jamaica, some of them travel to Malaysia, to China, to African countries, and currently they work as doctors. Unfortunately, you cannot see the photographs, but we have lots of photographs sent by our former students who sent our photographs. They're successful doctors nowadays. Some of them work in government institutions such as Ministry of Health. Some of them work as doctors. Some of them work as professors. It's also possible to gain some scientific knowledge, scientific experience. Presentation will not be it will not be possible to add presentation PowerPoint. I will not be able to use presentation photographs. Just my.
Shall I play from my side, sir?
Can you try? I thought you'll be turning you'll be providing the presentation, PowerPoint presentation.
Yeah, right now I'll share it, sir.
Because I expected you to just Dr. Avi told me that you'll be changing slides, and I thought there was kind of malfunction. If you can you try?
Yeah, I'll try it.
Then briefly we'll rush through slides because I explained some aspects. Just here is there is PowerPoint presentation on. Oh, good. So next slide, please. So Kazan is one of the biggest Russian cities. It's known as third capital of Russia. So Russian cities are not that big as Indian, and 2 million population is considered to be big in Russia. One of the trade and cultural places, also known as city of universities. So here is a view on Moscow, but Moscow is our capital, which is busy, nice, busy, but maybe less comfortable as far. Just next slide. Just Russia has long relationships with India. The next, please. And Kazan is developing modern city with lots of cultural places. Here are some theaters, opera, ballet theater. Unfortunately, currently, just today it's not possible to visit theater because still we have restrictions because of that lockdown. Theaters might be open from 1st of July or maybe 1st of August. We're expecting that. But lots of cultural places, and students are taken to those theaters, sports places. We have cricket teams, and we have nice program for foreign students, cultural program. Next. So here's Kazan, and that's Federal University, which is engineering and technical mainly. That's central part of Kazan. Next. Next, please. And Kazan, also known as city of capital of sports. So we hosted many world events such as aquatic championship and Universiade. So those were international events. Next. And we have also some traditions. This place a long time ago was taken by Mongols, and that's why we have some Mongolian names. And we have some traditions, some ethnical traditions, some festivals, ethnical festivals, and that's why we have quite strong Muslim influence. Actually, we can be called city of many religions, and all religions are peaceful and friendly towards each other. And some people celebrate all festivals of every religion. Next. So in winter, usual temperature is -10, but in coldest period, in the middle of January, it might be -20, 25, but it lasts about 2 weeks, and happens at the same time of Christmas holidays. And students even travel home during that time. It's not necessary to travel home. It's always warm inside all of our buildings, but it's time of holidays, and some students who can afford travel home for 2-3 weeks. It's possible to return, but that will be necessary to buy tickets. While in Kazan we have ice skating, we have skiing, and many other nice things for winter. That's why many students prefer to stay. Next. So unfortunately, spring was a time of lockdown, and this time our students were not able to have such nice picnics. But in spring, temperature is usually minus, it's always plus 15, plus 10, 15. And in May is usually plus 20. Next. In summer, temperature increases to 20, 30, and even 35. So for next week, expected temperature would be 25, 28 plus for next week. And it's nice for like walking our forests, parks. Next. Autumn is perfect time to start classes because it's not cold, not hot, and we have nice period of golden autumn. Next. And here are some of our cultural places. Usually on the same streets there will be church and mosque, complete friendship between different religions. Next. We even have a temple of all religions near Kazan on the left. And currently we have lots of graduates, and we are WHO recognized by World Health Organization and MCI, Medical Council of India. Next. We offer teaching general medicine, and our main program is MBBS in general medicine. Plus, some students may choose dentistry and pharmacy, additional programs in English medium. But main program for about 200 foreign students admissions per year, 200 per year admissions, general medicine, that's MBBS. And about 15 students for dentistry and 15 students for pharmacology, pharmacy. Next. So here are our students during their practice. As for our affiliations, I already said that we are world recognized, and our graduates may work in many international institutions, but every country has its own restrictions and examinations. For example, after returning to India, you'll need to pass the screening test in India. It was called MCI screening test and FMG screening test for the foreign medical graduates exam. And in America, there is USMLE, United States Medical Licensing Exam. So it's possible. It will require knowledge, and you come here for knowledge. Next. So here is our ranking among medical colleges. And that's among all medical colleges. And among, if we count only medical colleges, that's third position. Just on the position of 25, that's St. Petersburg University. Position number 24, that's Moscow University. Moscow University number 1. So Moscow, St. Petersburg, and Kazan. So Kazan is third after Moscow and Petersburg in the Russian rankings of medical colleges. Next, please. Another year we got second position of medical colleges of RS 2014. Next. So second position in 2015. Okay, next. Actually, I haven't updated this slide, but number of foreign students is growing every year. This year is 20% of international students, and majority of them are from India, but not limited to India. There are also students from, I already said, Malaysia, from African countries, from Latin America. Every year we have admissions worldwide. We have students from 50 countries but majority are Indian. Please, next. So our tuition, our program, MBBS program lasts 5.8 years. And you may ask me why the students need to study 6 years. Because actually in Russia, that includes clinical training. And it's like internship in India. And it's so some of postgraduate training is included. That's why after graduating in Russia, you actually get MD degree. MD degree in Russia, that's MD degree. But because of that government restrictions, because of Russian Indian government maybe misunderstanding, our degree is recognized only as MBBS. That postgraduate training in Russia is not fully recognized. Only undergraduate training is fully recognized. That's why our diploma transforms into MBBS in India. In Russia and in former Soviet Union, you'll be MD. Like former Soviet Union, like Turkmenistan, Tajikistan, that will be MD. While in India, only MBBS, but you also get extra knowledge and extra experience. Next. Here is our rector, Professor Sozinov, and Consul of India. Indian officers often visit Russia and Kazan because we have lots of Indian students. Next. Where they might be. So I already explained that, but the first years are theoretical fundamentals, that's anatomical theater, one of the unique buildings in Europe, and there are a few anatomical theaters left. And the label, the name on the top says that here's a place where dead people help to treat living people, where death helps to treat living. Next. So that's anatomical theater with there's natural skeletons and there are natural organs. Here are the natural preparations from our department, anatomical pathology. And we have a collection of natural microscopic slides and organs, how organs are affected by disease. Next, just you already seen that anatomical theater, and that's Pathanatomy Museum, 2,000 specimens in liquid. Those are organs or parts of the body or even entire fetuses in that liquid, those are living people, like hydrocephaly and scars on the right. Next. That's preclinical discipline. Then pharmacology, and here is a building of pharmacology of our university department of pharmacology. And there is a new hostel next to that, next to this facility. There is a new hostel, but this new hostel would be for top students, for students with top marks, for best students. You know, modern, high class hostel for best students. Next, based on the merit. Yes, there are common lectures, and in common lectures, usually there would be 100 students in one lecture room, common lectures. And in the right lower corner, you can see usual seminar. In seminars, there will be usually 10 to 15 students in a room. 10 to 15, in some groups, there will be even less, 9, 10 students. In some seminars, there will be 15, so around that in seminar. And on the, in the right lower corner, there's a seminar on pathanatomy with microscopes. Students study microscopic preparations of diseases. There are also gross preparations studied. On the top left corner, that's internal medicine. Top right corner, that's common lecture. And on the left corner, bottom left corner, that's college room in a hospital. We have college rooms in many hospitals. More than 50 hospitals have our college rooms. Next. Those are our graduates. Those are our former students, African students, Indian students. Actually, that's a little old information, not 565 from India, more than 900 from India nowadays. Next. Also, we have unique facilities such as Center of Practical Skills and standardized patient test, which will provide a certificate. There are invited professors from United States, and students may get certificate that they passed standardized patient test. Also, we have worldwide training courses. Students may have summer practice, and these I have forgotten to say about summer practice. Apart from seminars during autumn, winter, and spring, students also have some summer practice. Summer is mainly for exams in June, and then in July there are 2 weeks practicals in hospitals that can be done in Russia, in Russian hospitals, but also students may organize practice in India or may apply for training in Africa or even in America. As you may guess, there will be competition for getting such position for practice, like 10 per 1, and only top merit will get such practice, but toppers will get the opportunity to practice in most prestigious hospitals worldwide. Okay, next. It's about practice. Maybe next slide. Can I switch? Next slide. So number of Indian students is growing. That in 2017, 790. This year we have 900 students from India. Next. Additionally, students may get postgraduate training, and it includes various programs. As I already said, not all postgraduate programs are recognized in India. That's why only few students have postgraduate in Russia. But gradually we have more approved programs, including program in collaboration with Canadian Royal College, and students may also participate in that residency, and they'll get a certificate by Canadian Royal College. Also, there is competition to get this residency. Only toppers just with highest marks may get that residency, but they'll get a Canadian certificate of postgraduate training. That's for postgraduate. Next. So here are our graduates. I already said many of our graduates already work in India, in Mumbai, in Chennai, in Delhi, and other cities. So next. So some of our graduates even work as officers in ministries. That's with our invited professor from Yale. Okay, next. So that's about collaborations, global health elective, research in biomedicine, and joint research seminars. So as I already said, it's possible to have practice or also scientific programs worldwide. Some of our students applied for scholarships, and now they work as professors in colleges instead of practicing as doctors. They turned into theoretical professors, but some of them work as professors in European colleges. Next. So we also provide opportunity to practice scientific skills. We have student scientific circles in most departments, and that's first steps towards science, student scientific circles, and they may even apply for conferences and travel to conferences. Many of those conferences are subsidized. They'll get, university will pay for flight tickets, and some of our students had conferences in London, in Germany, in Poland, in just worldwide conferences. Maybe not United States, but in European, mainly European conferences, and university paid for the tickets. If students shown a good presentation and good scientific project, some students can be even sent to those conferences as participants with a poster or PowerPoint presentation. Okay, next. And that's cultural activities. We have festivals, including Indian festivals, Diwali festivals, various Indian dance festivals, which are can be hosted in university buildings or in hostels. We have special dance floors. Next, so our dance festivals, some Russian festivals, and the top right, there's singing, concert hall, there's cricket teams. We have a large set of cricket teams and cricket competitions, championships, for mostly for Indian students. Next. So not only cricket, skiing, skating, football, that's winter sports, winter leisure time. And in winter, if you wear good clothes, a good scarf, cap is comfortable. So our students enjoy winter. It's warm in buildings. And here is view on Kremlin and Kazan. Yes. It's also a nice place for parents to be as a tourist. Many parents visit our students and they stay as tourists. It's possible to invite a parent to travel to Kazan, and it's possible to enjoy a city as a tourist. There are flights from India. Nowadays, there are limited flights. We are expecting number of flights will be increasing. But Kazan has international airport, which is connected to Moscow and connected to Dubai, to Sharjah, connected to Astana. So it's possible to fly. Unfortunately, there are few flights directly from India. But from Chennai, many students fly to Dubai, Chennai, Dubai, Dubai, Kazan. That's the shortest way. Also possible to fly to Delhi, Delhi, Moscow, and Moscow, Kazan. From Moscow to Kazan, flight takes 1 hour. Yes, there is one more stop, but sometimes it's cheaper than fastest flight. Sometimes it's necessary to have 3 segments, 3 connections, but it will be cheaper. So students always check in those opportunities to travel, because they often travel in some vacations time. I think you are waiting for questions part, and please, you are welcome to ask your questions.
Thank you, Mr. Timur, for your speech. We'll wait for the participants. Let them raise the questions, sir. Any questions, Mr. Timur?
Don't hesitate, because first to come, first is served. So admission is based on the PCB results. I haven't said that. Yeah, admissions require having the results of physics, chemistry, biology. You'll need to have NEET certificate, and good results in physics, chemistry, biology. In each, it should be 65% in physics, chemistry, biology. Physics, chemistry, biology, and English. Sorry, PCBE, physics, chemistry, biology, English. NEET certificate. We don't request anything else, like Russian is not necessary. Only NEET certificate with good results of physics, chemistry, biology. Maybe other questions?
So how about the security for the Indian students, sir?
Security is common for all students, and Indian students are warmly welcomed by other students. There are no problems among Russian and Indian students. Some of them have even common cultural activities. We have a special security system in every building. We have a security guard in every building, pass system, cards with, I can even show you just a minute. No, sorry. No, I left. So ID cards with your name, with magnetic card. We have special magnetic gates. You'll need to attach your card, and only then you'll be able to pass. All visitors will need to register their passport. In hostels, those visitors are not allowed in evening. All visitors must leave hostels in evening time, all guests. Then all colleges have cameras, CCTV cameras, security cameras. And also students have special phone numbers for any complaints, for any worries they may ask, they may complain. Also, there are special dedicated students, special students, senior students who help young students, like not only security, but where to buy clothes, where to buy food, just what is appropriate, books, so they help. There are senior students who are helping young students. There were no criminal events for past many years in our college with foreign students, and our students feel safe. You asked me about the coronavirus infection. So during coronavirus infection, all our students followed usual procedure of lockdown. For 1 month, they were not allowed to leave the hostel rather than a reason. There were a list of reasons they allowed, like going to food, grocery, or some other activities, but limited number of activities, I can tell you. And students usually left home once in a day or once in 2 days for a month. There was time of restrictions. Now restrictions are decreasing, but there were no cases of coronavirus infection with any severe symptoms like need for ventilation or something like that. No, I haven't even heard of single case of serious coronavirus infection, and definitely there were no casualties. I can even tell you that in Kazan, less than 20 people died of coronavirus for that entire period, and that much less than in Moscow. That's advantage of having less crowded city. There are less people in Kazan. That's why we have less risks of spreading viruses.
So there is a question regarding hostel for girls, special hostel for girls.
Unfortunately, in Russia, it's not. We don't have such a procedure for foreign students, unfortunately, maybe. But we have only special floors for girls. We have cameras, and girls are highly respected in Russia. We have very strong movement of feminism in Russia, and women have very good rights, maybe even more than men. Like in America, women are highly respected, and in hostels, the only separation is by floor system. Floors for girls, floors for boys, and cameras. Boys are not allowed in that floors after evening time. Also, some girls, that can be done not only for girls. Some students may prefer to rent a flat, apartment, which will be much more costly than living in hostel. Hostel will cost a student $200 per year, like 14,000 rupees, 15,000 rupees per year, like 1,200 per month for hostel accommodation. That would be 4 beds room hostels, but it's rather cheap. So 1,200 and 15,000 per year. But we don't have special floors for girls. They may prefer flats. Flats will provide more comfort, but in flats there will be less mutual control. They'll not be able to look after each other. In hostel is kind of community. In hostel, all students study. They know the subjects. They may ask questions to their friends. In flat, there will be less friends around. But flats provide more local comfort. Some students rent flats. They do rent flats. Flat will cost 15,000 per month, one flat. But a flat can be shared by like 3-4 students, like 5,000 per month for students for rental flat apartment. It's more costly than hostel, and no good mutual control. Okay, let me see hostels. We have tests. We have not kind of screen tests. We have exams. Details of passing screen tests. I got this question. Was just almost 100 of our graduates successfully passed screen tests. Most of them passed screen tests, like more than 60% passed from the first attempt. But there are other attempts given for screening tests. Currently, more than 900 Indian students are studying in Kazan Medical College. 900 from India. Scholarships. Scholarships, we have, first of all, scholarship which is called discount system for merit. Those who got all excellent marks for exams. Every year we have exams. 1 or 2 examinations in winter, and usually 3 exams in summer. And if all exams were excellent, if marks for exams were excellent, there will be 15% discount. So 15% discount for toppers, for those who passed all exams with excellent marks. Those who passed exams with excellent and good marks get 10% discount. And those who got only good marks, 5% discount. Also, there is complete scholarship covering 100% expenses, but it's provided not by university, but by Russian government. You can apply for the scholarship, but the scholarship will mean education in Russian medium and additional 7th year of learning Russian. So there would be preliminary Russian course, and then 6 years of education in Russian medium. It can be done completely free of charge, and there will be even a stipend. You may apply for the scholarship by Russian government. A limited number of seats, but some students may get it. If you want to study in English medium, then you can only get this discount for marks. Maximum 15% off for good marks. As I already said, tuition fee is 5,500 USD, 5,500 USD per year. It can be reduced to less than 5,000, like 4,800 for good marks, if student shows good marks for the past year. So every next year, there can be discount for the past marks. We have postgraduate program, and I explained that unfortunately, our postgraduate programs are not fully recognized in India. Only a few programs can be recognized, and those who already got MBBS degree may apply, that have an MBBS degree. And there are entry exams, and it's also paid about 2.5 lakh per year, 2.5 lakh per year for postgraduate course. So any graduate with diploma, Russian diploma, may apply. So you need to have a Russian diploma, Russian certificate for postgraduate training. But first of all, students need to complete that undergraduate training. Maybe ask some other questions, please. The first year should be paid fully, then a student may pay in 2 installments, divide payments in 2 parts, like autumn semester and spring semester, so spring and winter semester. So it can be done in 2 installments, not more than 2. Maybe some other questions, please. That's an important question. Hostels, only one hostel is in the campus. That's hostel number 1, and it has a really limited number of seats. Another hostel is that pharmacology hostel, which is also part of our campus, but a little away from just a little distant part of campus. It's separated from our main campus. It's our satellite campus. Most of students will get hostels number 3 and 4, which is 15 minutes by bus or 35-40 minutes by walking distance. Actually 35 walking distance, 35 minutes walking distance, 15 minutes by public transportation. Public transportation costs 25-30 per travel, and there are monthly passes available. So the answer would be most of students will not get in-campus hostel seats. Usually there will be hostels about 2.5 kilometers from campus, That's about 15 minutes by bus. It can be walking distance also. Definitely, we do need results for admission. You need to have NEET certificate, and our official representatives, the study abroad educational consultants in India, are responsible for all admission formalities for passing NEET certificates and all documents, translating your documents into Russian, applying to university. So they'll be in charge of that admission. And NEET is a must. NEET certificates, including that marks of physics, chemistry, biology. NEET certificate must contain PCB, physics, chemistry, biology, and also English. We have that program of Northern America Royal College of Canada. That's postgraduate program. That's for those who already got diploma. Postgraduates may apply. Indian students also allowed to apply for that program, but there will be limited number of seats, and the competition will be merit-based. There will be an examination. Only those who got top marks in exam may apply. Tuition in that postgraduate program is about 2.5 lakh rupees per year. 2.5 lakh rupees per year. So just rubles per year. Rupees and rubles nowadays are very similar. Just you can tell me what is the difference. Like in so currently for $1 you need to give 70 rubles, 1 to 70 USD to ruble, 1 to 70. I think in India it's quite similar, maybe 1 to 75, 1 to 73, 1 to 70 ruble, dollar to ruble. Yes, we include MCI coaching starting from 4th year. There we get books of past MCI screening tests, and students are training based on those past MCI screening tests. Also, we have extensive use of the MCQ tests, like American tests, Indian tests. We use tests in our teaching program also. Important question about impact of coronavirus. That's a really important question. Actually, we're expecting our university will be opened on the 1st of September. We're expecting to be opened, but foreign students may not be fully able to travel to Russia because of a limited number of flights. So we are waiting for announcements from that air companies, and we need just to be realistic, not too optimistic, but realistic. And actually, most likely there will be a really limited number of flights in August and September. Our seminars must start on the 1st of September. And that's why we expect at least September and October. So September and October, we are already preparing to provide online training for the first 2 months. And we are hoping that by the end of October, our students will be arriving. And from end of October, we'll begin natural classes with our practical rooms, with our microscopic slides, with cadavers in anatomical theaters. So so just practice with hand skills, not only knowledge, not only books, not only tests, not only tele-lectures. So we'll provide that tele-lectures, we'll provide that tests, we'll be providing some photographs of various objects, organs, microscopic slides, but we realize that's not enough. For 2 months, maybe it will not be a big problem. We'll provide that teaching for 2 months, 3 months if necessary, but we are hoping it will end soon and our students will arrive normally the latest in November, maybe even in October. We cannot fully predict that air flights, when that regular flights will be reestablished. MCI coaching will not be charged. It's included in training. We provide that books. It's a part of education. That pass tests. We use tests based on that MCI books. Dress restrictions, we don't have, just it's quite interesting question. It's not really restriction. Students must be wearing uniform. With special, all students like doctors, they are wearing white aprons. A white apron. It's not kind of restriction. You may wear anything under your apron, but you should be able to put on apron over your shirt, over your sweater. So medical uniform, apron. We have second shoes in many buildings. It's necessary to carry some slippers. It's warm inside. Just students walk in slippers in our buildings. So in surgical wards, it's necessary to wear shoe covers. Shoe covers sometimes necessary in hospitals. In some facilities, it's necessary to wear caps, protective caps, covering hair. Caps, aprons, like doctors do, but we don't have restrictions of your dresses under apron. Yes, apron is a must. Apron costs 700, medical apron, 700 rupees per apron. You may need 2 or 3 aprons to have always clean white apron. Yes, students wear aprons in their bags to our classes because they are future doctors. That's our doctor's dress. So here I'm like a college professor, but also I wear apron. I work in laboratory. In laboratory, I wear apron. Medical uniform. Gown, apron. So MCI is not charged. And subjects, how many subjects for each semester? That's quite difficult to count because that depends on the particular year. In the first year, you'll study biochemistry, you'll study medical biology, you'll study anatomy, you'll study medical mathematics. Yes, and I think that's all. Then in the second year, you'll study histology, and still anatomy will be there, plus anatomy. You'll study microbiology, will begin, microbiology. So every semester you'll have, on average, 10-12 subjects. 10-12 subjects in semester. Among them, there will be 7 new subjects and 5 subjects from previous semester, which are continued from previous semester. So some subjects last for 3 semesters, some subjects last for 4 semesters, some subjects are only 1 semester long, like mathematics would be 1 semester long, while internal medicine would be 4 semesters long. Path anatomy lasts for 2 semesters, are my subject, from the beginning of third course till the end of third course. So again, successful rate is close to 100%. If we count all attempts, if all attempts are counted, all students pass that MCI exam, medical graduate exam. All students pass, but every year you have only 2 attempts. Some students will pass after 2 years, but it's there are no such restrictions. Semester starts in the 1st of September. 1st of September this year. We are preparing that on the 1st of September, online education will be available. That's Zoom-based training. We have educational portal with many tests as an educational portal, similar to MCI tests or USMLE tests. Semester from the 1st of September ends with Christmas celebrations. Then there will be Christmas holidays. After Christmas holidays, there will be exams. Exams lasting for about a week. And then from February, from 1st of February till end of May, next semester. In June, exams. In June, we have only exams. And then in July, there should be summer practice. Summer practice, again, can be done in Russia, in Russian hospitals. Practice means observation. You write a diary, what you have seen, and you try to absorb the knowledge from your supervising doctor. There will be supervising doctor, and there will be a short test after that training. It's also kind of subject that summer practice is considered to be practice. Vacations. We have vacations in from end of July and ending up in end of August, like from 20th of July till the end of August. Then from 1st of September again classes. And 2 weeks vacations in January. In the coldest time in January, we have 2 weeks vacations. It's possible to come home during vacations. That certainly will be costly. One flight costs around 30,000 per flight. If you can afford, you may fly during every vacation. It's allowed, definitely it's allowed. But some students prefer to save and stay home for just 2 flights. They can buy a new iPhone instead of coming home.
Participant, any more questions?
Mm-hmm. Yes, I'm checking. Maybe I skipped some of questions.
Yeah.
So hostel is there are several hostels. One hostel is in campus. Another hostel is in our satellite campus. It's actually pharmaceutical college with its special hostel. It's pharmaceutical hostel. And third and fourth hostels are 2.5 kilometers, just 15 minutes by bus.
How about the food, sir? Food for the Indian students?
Food, just unfortunately, in our hostels, we don't, so far currently, we don't have mess facilities special for Indian students. Many students ask about that because we used to have one, and not even one. We have such mess facilities in several hostels, but students decided that they will be saving money. They stopped buying food in that cafeteria and started to cook themselves. Our hostels have kitchens. We have refrigerators. We have kitchens. It's much cheaper to buy rice, to buy carrots, to buy some onions and cook biryani yourself. So most students cook food themselves. It's much, much cheaper. Like 1 kilogram of rice costs 40 to 60 rupees. 1 liter of sunflower oil costs 70. Just 1 kilogram of chicken costs 120. Like, I don't know. The carrots, 25 per kg. Everything can be bought here. Maybe some types of food more expensive. Fruits are more expensive. Bananas cost 70 per kg. Pineapples 100 per kg. Pineapples sold per kg here. Oranges 60, 70. Apples 60 to 80. That depends on season. From 30 actually. We have we have domestic apples. In season, they're quite cheap. So everything can be bought, and most students cook themselves. Also, we have Indian restaurants in Kazan. We have like Malabar Indian restaurant. They are quite popular, and guests from India said that as good as in India, well, just very good restaurants, but the restaurants are rather expensive. One visit to a restaurant will cost you like 1,000. Just depends, 5 to 1,000 per one meal in the restaurant. Okay, just it's possible. Students have no problems with buying food and cooking food. Just
you have a question in the chat.
Students learn to be independent from parents. Students learn to cook themselves. That's it. No, not always in restaurants. Maybe some other questions.
Sir, regarding insurance, will it apply for medical expenses?
Insurance will cover mainly serious diseases such as trauma, injuries. Insurance will cover diseases such as like ulcer, a need for surgery. Insurance will not cover dentistry expenses, but dental expenses in Russia are not expensive. Like one tooth, fixing one tooth will cost something like 2,000 to 3,000. Like cavities in one tooth, 2,000 to 3,000. Just, I think, can be compared to Indian expenses, or even cheaper. Dental expenses are not included in insurance, while serious diseases such as, again, ulcer, like infections or like injuries would be covered. Appendicitis definitely just can be treated. Simply. Maybe there are some additional questions. Expenses.
So if anybody fails, will they get any chance to write the exams?
Yeah, we have, just that was actually I was going to explain, that every year we have 2 periods of exams, 2 sessions. In winter, 1 or 2 exams, and in summer, in June. In June, usually we have 3 exams. And students will be given 1 semester to clear that academical pendings, academical debts. So students will be given 3 attempts. 3 attempts. Like if exam was in summer, 1 attempt would be in summer, and 2 attempts would be in autumn. If student failed after 3 attempts, student can be offered to stay again for 1 more year on the same course. So student can be allowed to stay again on the same course, but it will be necessary to repeat the course after failing 3 attempts. 3 attempts are given.
Thank you.
3 attempts and half of a year to clear that subject.
In case if he doesn't finish, means he has to
need to repeat the course.
Okay. So you have a question, books and study material provided by the university college?
Yes, we do provide books. We provide some manuals. We have library also. We have electronic resources, many electronic resources. We have educational portal, which is nowadays developing because of that lockdown, and we are using that educational portal. We provide also like paper books, hard copies. We provide electronic books.
What is the timings for the classes, sir? Timings for the classes?
Usual timings. That depends on the particular course, and just every course schedule may change, but usually from 9 to 12, just that will be quite rough. Actually, just exactly to be from 8:50 to 11:30, first seminars, then from 11:20 till 12:30 a lunch break, then from 12:30 till 5 next set of classes, like from 9 to 5. On Saturdays, we also have classes usually from 9 to 2 p.m., 3 p.m. In some days, there will be little shorter days, like sometimes from 8 to 3, while sometimes class will last to 5:30 p.m. 5:30 p.m. Just 17:30, 5:30 p.m. Usually from 9 to 5. You may consider from 9 to 5 with a lunch break. There are also short breaks between seminars. Between seminars, we have 10-15 minutes breaks between seminars, and 1 hour lunch break between the first and second half of the day.
So the exams are oral or?
This year, everything changed. Usually, most of exams are oral. We were exams with in that lecture halls. There are examiners. In this year, many exams are arranged in that test form, such as MCI exam, similar, and that's also quite an advantage actually, because many students had oral exams several years, and 1 year more tests. We have more tests this year, and that's also opportunity to be trained with tests. And next year we'll come back to like predominance. There will be mostly oral questioning, oral exams, and about 70–80% of exams are oral exams. This year, about 50% of exams are oral and 50% are via Zoom, and 50% of exams will be in test form this year. But usually 70–80% of exams are oral. That's due to that lockdown. We have some changes.
When do they have the practical, from which year the practical starts?
Practical starts after third year. After completion of third course, there'll be practicals. First, there will be practice nurse assistance, like injections, intravenous injections, catheterizations, taking care of patient. Fourth year, there'll be ambulance doctor, ambulance, paramedics, like sometimes even driving in that ambulance car. Then assistance of surgeon, assistance of obstetrician, and assistant of physician. That will be after fifth course. So after third, fourth, and fifth course, there'll be practices. So three periods of summer practice. And again, this practice can be allowed in India. All students may apply for that summer practice in other countries, like African countries in that Red Cross system, in that Asian countries, or in America. For America, there are many people who are willing to have summer practice in America, so there will be a competition to get that American practice.
What is the attendance percentage there?
Attendance is compulsory, and we have rating system. If student is not attending classes, every missed class will be marked, and that will have impact on the final mark. That will reduce the mark. Also, that missed classes will be reported to parents. So attendances are compulsory. We realize that some students may get ill, and if students missed 1–2 classes in a year, that's not a tragedy. But if students stops attending several classes in a row and doesn't have a paper proof that he or she was ill, then that will have impact on rating. Or if student missed 2 months, first of all, we'll inform dean and parents, and that may lead to repeating the course. If student missed more than half of course, it is considered that course is failed, and it's necessary to repeat the entire course and to stay again on the same year, same course. We provide opportunity to catch up. There is a system of reworks. We allow to provide conspects, to answer questions, to do practicals, and to prove that student masters that topic. It's allowed. But again, better don't miss more than 1–2 classes per year.
Is there any restriction for the students to go out of the universities, for the hostels? Is there any restriction?
Hostels are closed after 10. It's not allowed. And there was some, so students are informed, and they write consent that they inform that they are not allowed to enter hostel at night. On another hand, we don't have restrictions on traveling in cities. Students may go to places of interest. They may go to cafeterias in free time. They may go to cinemas. They may go to parks. They may have sports activity in city. Some of our students even arrange traveling to other cities, like to Moscow, Petersburg, during, for example, vacations. Instead of having vacations in India, they spend vacations in Russian cities. There are very nice Russian places, like Petersburg. It's like European city capital, one of the European capitals, and cultural place. Or Moscow, like Mumbai, luxury place. It's possible. It's not, and even parents may do that. They are allowed to travel during vacation time. So there is no picture, no image. So security, there are security-based restrictions, and it's not allowed to leave or enter a hostel at night.
Thank you.
And our college have pass system, card pass system.
Any questions?
Some more questions.
Manoj, ஏதாவது questions கேட்க சொல்லுங்க மனோஜ்.
Okay, sir.
No questions.
Students, do you have any questions? ஏதாவது questions இருந்தா கேளுங்க. தமிழ்லயும் கேட்கலாம், நான் டிரான்ஸ்லேட் பண்ணி சொல்றேன்.
I'd like to ask about graduate med North American pathway. Can you please tell me the admission process, how it takes place, and what is the admission process for that course?
Admission, yeah, thank you for question. Admission procedure is organized by study abroad educational consultants nowadays. We have delegated that procedure to study abroad educational consultants. And first of all, you'll need student need to carry a need certificate from school, a need certificate with marks in PCB, physics, chemistry, biology, and English, PCB. That's our requirement. Also, that study abroad educational consultants will help you to organize a foreign passport, to write admission letter, to translate all your documents, domestic documents. That's it. We don't have any special requirements. Just bring that need certificate to study abroad education consultants, and they'll guide you with next steps of educational admission procedure. So university is not organizing admissions in other countries. They only have that partners who prepare all documents. There are lots of bureaucratic formalities. It's not as easy to organize documents, and documents must be processed. So all the admission steps are done by study abroad consultants. So in Chennai, they are sending students for a long time, and I think many students already returned after completion of Kazan Medical College. So students sent by study abroad already returned to Chennai. So they're returning back and already work in hospitals of India. So just need certificate. That's what we need. Yeah, they posted the contact number of that.
Yeah, that is
study abroad.
I have given our contact numbers.
I used to visit India as a representative of this college, but it was only just a visit of representatives. So I was not hosting admissions directly, and here I'm just also kind of guest. I will not organize admission here. I'm just a faculty and vice dean of this university. So you must make questions about that educational process, about our students, maybe some Indian students, maybe you know some of our Indian students. Maybe I can even tell you, I teach 30-year students, 30-year students.
Any more questions, please?
So there will be no entrance exam hosted by university. There will be just checking all your NEET certificate, your marks in physics, chemistry, biology, and whether you're eligible or not based on the PCB results.
Can you please repeat that eligibility marks in physics, chemistry, and biology?
Regularly, our eligibility marks in PCB 65, but in some cases that can be reduced for some groups, for some categories of applying students. Those marks can be reduced, and you may show your marks to that study abroad consultants. They'll tell you whether the marks will be acceptable or not. So that also depends on some other factors. But our basic threshold, 65% in physics, chemistry, biology. Physics, chemistry, biology, English, 65%.
Okay.
But again, with some additional proof, some additional documents, those marks can be reduced in some cases.
And does it have any separate process of admission for this partnership program, which I've asked you? This is the partnership graduate med North American
for all
pathway.
college. First of all, this program is only for graduates. So that's program for graduates. And you first of all, you need to carry a Russian diploma of Russian college, medical college, and only then you may apply. You may have this diploma from other medical college of Russia, not only in Kazan. You may come to Kazan with another diploma, like from Moscow. You may apply, and there will be exam and competition of marks. Top marks will be invited.
It's not MBBS admission, right? It's graduate.
That's only for graduates. That's only for graduates. That's already have MBBS. Already have. That's for graduates.
Okay. Thank you.
Program for graduates.
So one more thing I'd like to ask. You told your college is third oldest university.
Mm-hmm.
What is the first and the second oldest universities in Russia?
Those top universities are changing, but usually the leaders, that's Moscow in Medical University #1. We call it first Moscow Medical College, Moscow College #1, Sechenov Medical College, and St. Petersburg Medical College, Pavlov Medical College. Also, there is Medical College #2 in Moscow, which sometimes gets position #3. And also Nizhny Novgorod Medical College also sometimes gets a position. So that's leaders in top 5 medical colleges, among top 5 medical colleges. So 2 Moscow medical colleges, St. Petersburg, and also Novgorod and Kazan. Kazan Medical College is one among the group of the leaders. Mm-hmm.
My basic question, though I'm not a medical background, but basically this curriculum structure is similar to Indian medical curriculum, or will there be any difference?
There will be some differences because first of all, this curriculum is close to European programs and Russian medical programs, but the difference will not be in what we teach. The difference will be in the timing of courses. In the, for example, some courses which are usually taught on the 3rd year in India will be taught on 2nd year in Russia. There can be such differences, but subjects will be same. We have same set of subjects. So anatomy is everywhere, like in Russia, in India, in Germany, in America, same anatomy, same histology, same physiology, same biochemistry, same pathanatomy. We teach according to American book, Robin's Basic Pathology, or Pathologic Basis of Disease. American standard book. In India, students are taught according to Harsh-Mohan pathology, but Harsh-Mohan pathology is a kind of copy of Robin's pathology. It's very similar to Robin's pathology. So in most of aspects, we can say that we teach the same. Maybe a little different point of view, but same diseases, a little different structure of different schedule. Like I already said, in India, the subject starts on the third course, while in Russia, they'll start in the middle of second course. They can be such a difference. But same subjects. We even have subject of tropical medicine. We incorporated public health in India in our public health. So there is such a subject, public health. And we have a special part like public health abroad, including India. Tropical medicine, MCI training. That's also included in our teaching.
That's what I understand, that since in India is a tropical country, so the diseases are basically tropical diseases or something. But in other countries, Western countries or Russia or European, it will be mostly into the preventive medical kind of thing. But here it's a tropical diseases treatment is dominating. That's what the experts are saying.
Maybe I can answer the question a little differently. As for treatment, yes, brand names of drugs are different in every country, but diseases have the generic names, official generic names, not branded names, but generic names, like not aspirin, but acetylsalicylic acid. So students will learn it according to the generic name. They also know the most common patented names. They are also taught, but they'll have that basic knowledge of that generic names of every drug. The dosages, and if they know the generic names, they'll soon learn the brand names in India. That's not a big problem.
I have one more question. Do you have any feedback from the students graduated from Kazan?
Yes,
generally, there is a feedback that I mean doctors studied in India.
Yeah.
Whether they are always at par with the doctors coming from other universities, overseas universities.
So we do have, I even shown some photographs in my presentation. We have alumni of our graduates, and even we had a meeting. So me and professor, so my chief, that Professor Kashpayev Elena Svятославовna, that's dean. We've been to India and Delhi, and we had a meeting with our graduates. And nowadays there are grown-ups, doctors, really serious people. We had a meeting with them in Delhi. We also follow them on the social networks, and we see how they're developing into doctors, how they change into doctors. And they're happy and saying, sending positive feedback and even some nostalgia about the past years, about our college, how they stayed in Russia.
So they are doctors from Kazan are equally treated like doctors in India. They can go to government hospital. They can work in government hospitals in India.
Sure, they do work, and they already employed. Many of our graduates already employed. Definitely, they'll need to pass Indian that screening test, FMG, for the foreign medical graduate exams, that MCI test.
So they are not treated separately since they are
No. That's diploma is recognized, and they soon become a part of doctors' community of India. Some of them even, not all, but some students even apply to programs in European hospitals and colleges, and they have postgraduate training in Europe, and some of them stay in Europe. It's also possible to have postgraduate training. So first to pass screening test, and the undergraduate student pass the screening test, then then training, then residency, for example, in Germany, and then stays in Germany as a doctor. That's also possible. I haven't said that after returning back to India, they'll need to have postgraduate training in India. After returning back, postgraduate training will be necessary to become a full doctor.
Okay, okay. And what about the chances for pursuing postgraduate in US?
In America, it's much more complex. In America, the students, applicant need to pass USMLE exam, United States Medical Licensing Exam, which is tough and charged. Every attempt around 6,000 USD for USMLE, 3-step USMLE exam. And then they also need to have postgraduate in America. It's possible, and even some students have applied, but USMLE is tough and America is expensive.
Pursuing PG in again in Kazan, how will it be easier, or how the process will be after completing the MD program? So any further specialization is possible in Kazan University?
It's possible. It's even possible to stay here after doctors, to stay here as doctors. I know some of Indian nationalities people who stayed here as doctors. There are a few people who work in Russia as doctors. They do stay. But I can say that unfortunately Russian doctors are not so well paid in Russia. Doctors are not highly paid in Russia. We have quite many doctors. We don't have such shortage of doctors like India has. That's why Russian doctors are somehow underpaid. But it's possible. It's also possible to have postgraduate training in Russia. But I already said that only that Royal Medical College of Canada, South America, certificate will be worldwide accepted. Other certificates are not fully accepted. There is a limited list of countries which will accept that postgraduate certificates. And that's why better go to MBBS. Postgraduate training in Russia again is possible, but it's too difficult afterwards.
So the best way is to complete MBBS in Kazan,
MBBS, and then postgraduate in India, back in country where you're going to work. I can even add that postgraduate training, you are getting acquainted maybe with your future work. So like you have postgraduate training in like Jeepmere Hospital or Sri Ramachandra Hospital, and then you are staying in this hospital as doctor, because postgraduate training often linked to your future occupation there as doctor. You can get this position. Particularly in Russia, it's a very common thing that you train in this hospital and then you stay in this hospital as doctor. Because postgraduate,
okay.
Postgraduate training is often linked to employment.
Okay. Thank you very much for you. Thank you very much.
Any more questions? Shall I close the section, please?
That's why we just, maybe it's 2 hours past.
Yeah, sir. We'll see any questions, otherwise we'll close the section, sir.
For me, it's time to go. I have 5 more minutes, but then I have an appointment just soon.
Oh, sir. Okay, sir. Thank you, Mr. Timur. We'll close the section because there is no questions.
Okay, maybe you can send some of questions and I'll later answer them. If this chat will be available, I'll just type answers.
Yeah, sir.
And those who are interested may read.
Yeah.
If you can extend this chat, maybe I'll answer later some more questions. Okay, thank you for interest. We invite you to Russia. I hope our flights will be normal, and soon there will be as many flights as we had, and direct flights to Russia will be opened soon. those who choose medical profession need to learn need to understand that it's not like road covered by roses. They need to study, they'll need to learn. They need to memorize many terms, it's quite tough. Like anatomy is the first subject, they'll need to memorize 1,000 of new words, including Latin. I have forgot about that. Latin terminology is compulsory, drugs in Latin, bones in Latin, blood vessels in Latin, parts of brain in Latin. Latin medicine will be, medical terminology is also must. And if you study diligently, if you put effort in your classes, you'll become a doctor. That's what you can ask. As for admissions assisted by study abroad educational consultants, those are our trusted partners in India. Those people already sent many batches of Indian people, and already they returned, and they're already doctors. Again, thank you for interest.
Thank you very much. Thank you. Thank you very much.
Thank you, Mr. Taimur. Thank you, all participants. Thank you very much.
Okay, I think I'll log off. Yeah.
Yes, sir. Thank you.
Okay, goodbye.
Dear participants, next event on the 10th, 11th and 12th and 13th இருக்கு. 10th for Far Eastern, 11th for MEFI, and 12th for Volgograd, and again 13th Kazan we have. If you are, please join that webinar too, please. Thank you.
Thank you very much.
Thank you, sir. Thank you.